Well, 20 years ago, 20 physicians got together to start a multi-specialized medical group in Savannah, and since then, SouthCoast Health has continued to grow.
The group is now 4 times the size it was back then, with 80 physicians and 18 locations. So joining us this morning from South Coast is John Marrero. Thank you for joining us.
Good morning.
Hey, John. This growth has been pretty remarkable. For 4 times, to grow by 4 times over 20 years is pretty good growth.
It's been a wild ride. It's been a lot of fun. We started out several small groups in Savannah, independent physicians, decided to come together. We originally started with 20 doctors, and today we're 80. We're actually 120 providers, if you include all our other paraprofessionals, and we have over 600 employees. So quite a change over the last 20 years.
What benefit to the patient is it to have a collection of physicians like this?
You know, I think one of the big things that patients benefit from is just the ability to have coordination of care. All of our doctors share a common electronic medical record. Oh, wow. So when you go from doctor to doctor within the group, each physician can see what the other physician is doing. They can read their notes. They can see the medications that have been prescribed, all the test results. So you really get better coordination of care. And, you know, that's one of the things that led to us getting accreditation as a patient-centered medical home, is the ability for all the doctors to work together collaboratively to care for the patients. So.
I would imagine it helps also with referrals.
It certainly helps that many times patients, we all hear the stories of, I get referred to a specialist, when I get there they don't really know what's going on, and the patient feels like they're kind of caught in the middle. When you're in one group and you're really sharing medical information, when you do refer a patient to one of your partners, of course, they know what's going on. They're better informed about what's going on with the patient's health and what their involvement needs to be in that. So again, less stepping on toes.
And is South Coast kind of embracing new technology with consultations with tablets and stuff with doctors instead of just that face-to-face?
Yeah, absolutely. You know, it started with the electronic medical record, and we've seen just an evolution. Healthcare is going through a lot of change. 20 years ago, everything was paper, and now everything is electronic, and we're really having to rethink how we deliver healthcare. And certainly, South Coast is looking at technologies that will allow us to do telemedicine, to be there for the patient beyond just that normal 8 to 5 office visit. If we're going to improve health care, if we're going to make our patients better, really improve the quality of care we deliver, we can't just do it between the hours of 8 and 5.
Right. How unique was this 20 years ago?
At that time, we were the only group in really this region, probably outside of Atlanta, that really did this. Today, I think we're the second largest independent multi-specialty group in the state. So it's still kind of unusual. Certainly there are hospital systems that employ a lot of physicians, but as far as independent physicians coming together, it's still pretty unusual in the state.
So advancing technology is one of your goals. What are some of the other goals in the next 20 years?
Well, I think all of the technology and everything that we do is really driven around quality care. And I think that one of the big benefits of moving to electronic medical records and some of the other technologies is, for the first time really in medicine, we have the ability to really report on quality and look at quality in a very dynamic way. And so our focus today, tomorrow, and into the future is going to be, the highest quality care at the best value. And in that, I mean just making sure we're doing the right thing at the right time for the patient to get the best outcome for the patient.
So there's not only a team of physicians, but I guess it's kind of a cohesive administration as well, and that's your side, right?
Absolutely. As a group administrator, it's my job just to make sure that the day-to-day operations take place, but it's also to make sure that we're administrating our accountable care organization that we're a member of, that we're producing quality reports for our doctors to help support their initiatives, just to work towards our diabetic care program. We're a breast center of excellence. So it's just making sure that all those pieces, that administratively we're handling all that so doctors can do what really they need to be doing, which is taking care of patients.
Any big plans to how to celebrate 20 years?
You know, our focus is really on 2 things. One is we are really focused on our employees because they're the ones who got us here. Were it not for our great employees, we wouldn't have been here over these 20 years. So a lot of what we're doing is around our employees and certainly around our patients. So we are having a lot of little events at our practices to celebrate our employees and thank them for all their hard work.
Well, congratulations to South Coast. 20 years in Savannah now, 18 locations around our area, and still growing.
Thank you very much.
Thank you so much.
All right.
A food truck festival with a side of exercise. That's next.